It's a big day for Gabriella Calabresi. She's 22, and at 274 pounds, she is the heaviest she's ever been.
Weight loss has always been a struggle for me. Ever since I was a kid, it's always been fluctuating up and down, regardless of how I'm eating.
She's hoping to take control of her weight while she's young.
My mother and my father both have had their own different kinds of struggles with being overweight. A lot of people take it as, oh, you're just very lazy, you don't put in the work.
We're going to put the nose spray in.
So where diet, exercise, and medication have failed, she's hoping an unorthodox procedure will help her succeed. Gabriella is having a nasogastric feeding tube, or NG tube, inserted through her nose, down her throat, and into her stomach. She's allowing us to be in the room to watch her doctor put the feeding tube in. There's nothing pleasant about having an NG tube. It's used in surgical patients in the hospital and chronically ill people who can't feed themselves. But Dr. Oliver DiPietro is using it the exact opposite way for people who can and do feed themselves too much.
Obesity is a real disease and needs to be treated like a disease. We have a very effective way of causing weight loss in a safe way using a feeding tube.
The tube will deliver 800 calories of liquid into Gabriella's stomach every day for 10 days, causing her to lose at least 10 pounds.
Patients could lose 1 to 2 pounds a day. Most of it is fat, some is water, but most is fat.
Each 10-day treatment costs $1,500, not a penny covered by insurance. Medical ethicists like Dr. Kenneth Goodman question the use of this life-sustaining procedure for weight loss.
That's just a lot of money you're spending for no particularly good reason. What's the good reason?
Dr. DiPietro's been using the feeding tube diet on patients since 2011, and he feels the feeding tube diet should be seen as an alternative to weight loss surgery.
You could lose 10 to 20 pounds per month, and cumulatively you could lose 100 pounds in 10 months if you have to. And that is comparable to bariatric surgery.
This procedure is not widely embraced by doctors, at least not right now. Only 13 doctors in the U.S. are using it. DiPietro is the only one in Florida.
The idea that an intervention that increased risks of infection in a vulnerable, desperate population only works for a few weeks strikes me as really worrisome.
Like most of the detractors, Goodman's primary concern is that people just regain the weight.
It's not effective. In fact, the very definition of efficacy for weight loss is that it lasts longer than a short while.
And guess what? Dr. DiPietro agrees.
Many patients put the weight right back on if they go back to eating the way they were eating.
In fact, Gabriella is a perfect example. This is not her first feeding tube. She did this 4 years ago when she was 18. People ask you questions or stare.
Oh my God, everybody stares. It's really funny because everybody's used to seeing a tube in your nose, meaning, oh, does she have an illness? Is she sick?
She didn't mind all the stares because she lost 16 pounds.
I would hear people literally whispering, that poor girl, I wonder what's wrong with her. And I'm like, nothing's wrong with me. I'm just trying to be healthy.
4 years later, she is 60 pounds heavier than before.
So I've tried plenty of diets. Anything that you can think of, I've probably done it.
She's more determined than ever to get down to a healthy weight. So for 10 days, this is her reality.
It's like you have a little something in your throat. You know when you want to clear your throat? That's what it feels like. You just want to go, mm-mm.
When the tube comes out, the hard work begins.
My motivation, honestly, is just to be healthy and feel good every day.